Good afternoon, everybody. We are here because of the haze. We're all affected by it. And today I'd just like to share how we will address the problem and also to explain to Singaporeans how each of us can protect ourselves and our families. Haze is not a new problem for us in Singapore or for Malaysia, our neighbors. This afternoon, the 3-hour number for PSI reached 371. It's come down a little bit since then. If we look at the which is a new high. If we look at the 24-hour number, the last reading at 2 p.m. was in the range 175 to 207, which is in the unhealthy to the very unhealthy range. And our health advisories are based on the 24-hour PSIs. So over the next few days, according to our Met people, the wind and weather conditions are likely to stay about the same as they are today. And so we expect the haze to persist for some time. I think we know the source of the problem, which is illegal burning by errant companies in Sumatra. We are actively engaging the Indonesian government to solve the problem. Foreign Minister Shanmugam and Minister Vivian Balakrishnan have been in contact with the Indonesian counterparts. They spoke to them yesterday. And our CEO of the National Environment Agency, Andrew Tan, is in Indonesia today having a meeting with the Indonesian officials. And I am also writing to President Yudhoyono to register our serious concerns and to reiterate our offer to help Indonesia to solve this problem. We've provided satellite hotspot data and imagery to the Indonesians to help them to identify the companies which are responsible. And some Indonesian officials have suggested that these errant companies may be linked to Singapore and Malaysia. So we've asked them for the evidence which they have and to provide us with this evidence. And if any Singapore companies are involved or any companies which are present in Singapore are involved, then we will take up this matter with the companies. But our priority and my priority is to protect the health and safety of Singaporeans, and especially of the vulnerable groups like the young and the elderly and those who have heart or lung diseases, for example, asthma or COPD, chronic obstructive pulmonary disease. I think we can expect a higher incidence of respiratory diseases under these conditions. It happens every time, it's natural. And our MOH medical system, the doctors, the polyclinics, the hospitals, they're all on alert and ready for this, to treat the patients. So if you fall ill or if anybody you know falls ill, and it's a respiratory problem particularly, please see your doctor or your GP promptly. And if anybody needs financial help with their medical expenses, we will make sure that it's available. MOH will be implementing a special scheme where young Singaporeans, the vulnerable ones, young ones 18 and below, elderly Singaporeans 65 and above, those who are CHAS card holders, those who are on PA, public assistance and medical fee exemption card holders who have respiratory problems or conjunctivitis, because of the haze, they can see their doctors, pay $10, and MOH will settle the rest of the bill. It's a special program, special scheme to deal with this exceptional situation. But for most of us who are in good health, I think we'll be fine if we just take basic precautions like limiting outdoor activities and staying indoors where possible, depending on how bad the haze is. Starting today, later this evening, the government will hold daily press briefings to update Singaporeans on the haze situation and to recommend protective measures for the day ahead. And NEA's website will be kept updated with information and with the guidelines and advice. Our ministries and agencies are prepared. The Haze Task Force has met several times to coordinate all the agencies' plans, and the Crisis Management Group for Haze has also been convened. We can't tell how this problem is going to develop because it depends on the burning, it depends on the weather, it depends on the wind. It can easily last for several weeks, and quite possibly it could last longer until the dry season ends in Sumatra, which may be September or October. So we will need to adapt our response to suit the changing situation and to protect ourselves in practical and sustainable ways. To oversee the overall national effort, I've set up a Haze Interministerial Committee. It will be chaired by Minister Ng Eng Hen, and it will have representatives from Environment and Water Resources, from MFA, Foreign Affairs, from MCI, Comms and Information, from Health, from MSF, Social and Family Development, from MOE, Education, and from MOM, Manpower. The Ministerial Committee will focus on protecting public health and safety, on working with Indonesians to mitigate the haze at source, and to maintain our economic and social resilience. It'll review the guidelines for protecting vulnerable groups. It'll ensure that society and businesses, and especially essential services, continue to operate, and it will issue clear guidelines on the protective measures depending on the PSI level and the projections. So I ask Singaporeans, please remain calm, look after one another. Watch out for your neighbors, especially the older Singaporeans or the kids. And if any of them have respiratory problems, please advise them or bring them to a clinic immediately. And if you have any questions, contact your RCs, your resident committees, your grassroots, or your MPs. They will have advice for you and assistance for you. And I'm quite confident that we can manage this problem and we can go through it if we stay together and work on it together.